First chink in the armor, man. There it is, right there.
And we're live now. We've been talking about Phil's beatboxing skills, folks, but
or lack thereof.
Or lack thereof. I mean,
mostly lack.
Welcome to Let's Talk Coronavirus, folks. We're really happy to be back again. I'm Rachel Bergstrom. I teach in the biology department and the health and society program. I'm also one of the co-instructors for our summer COVID, a pandemic is more than a disease class, which is part of the reason we're here. If you haven't been with us for the past few weeks, we are teaching a class for incoming first-year students at Beloit College. They are in the audience here with us today, and I'll let my co-hosts introduce themselves and our guests. One of you have to introduce our guest, and then remember that we are taking questions in the Facebook chat or with this video. So, all right, Ron, go.
All right, will do. So, hi everyone. My name is Ron Watson. I teach in political science as well as our health and society program. And I am also one of the co-instructors of our coronavirus, more than a disease. Or more than a pandemic. What do we call it? Anyway, our coronavirus course. I'm one of the co-instructors for that as well.
And I'm Phil Chen. I am the third co-instructor for the summer COVID class, and I teach in political science, and I also teach the methods course, which is cross-listed in health and society. And we are super excited this week to have two fantastic faculty members from the economics department. For a little context, they had some great readings that our students read and discussed on Monday, and now we are bringing them on to Let's Talk Coronavirus on Wednesday to give us a little bit more context about the economic aspect of the pandemic. And so I will turn it over for introductions from Zip and Bob.
Okay, I go. So hello everyone, my name is Zip Fan. I teach in the economics department. I teach many courses, but my favorite are Asian economies, economics of globalization, international economics. I'm kind of consider the international economies on campus, so I will bring the global perspective into our discussion today.
And hi, I'm Bob Elder. I'm also in the econ department at Beloit College. And I teach our macroeconomics course along with money and banking and game theory. And sort of as a macroeconomist, I'll focus on the US economy during my remarks.
Right.
Excellent. So I want to start out with a little piece of news that we were talking about right before we got started here. One of the big deal COVID situations right now is about vaccines. And I know it doesn't necessarily sound like it's econ related, but it is, people. So there's two promising trials, at least two promising trials of vaccines that are looking like they might be something that actually can be protective against COVID. And so, Bob, I was wondering if you could share a little bit about what you've learned about the vaccines or what you've heard about the United States and our approach to vaccination from an economist's perspective.
Sure. So news was emerging just this morning that the federal government, the US federal government, is spending $2 billion to pay Pfizer Corporation for 100 million doses of a vaccine. So that is $20 per dose. The regimen that Pfizer would implement is actually 2 doses. So you would take 2 doses to get vaccinated, and the price would be a grand total of $40. Now, presumably this $2 billion that the federal government is paying bears all the costs of the purchase of those doses, and they would be free to citizens of the public, but we might have to pay a nominal fee to whosoever administers the regimen to each of us. The clinical trials for this Pfizer product are ongoing. But from what I read this morning, if all goes well, this might become publicly available as early as October.
Well, and that's really, I mean, it's fascinating to think about spending this amount of money on vaccines for the public. And part of what this came out of in our conversation was the students in our class read a few articles where economists were making suggestions for how do we actually fix the economy. And how do we recover in the economy sense from this COVID pandemic situation? And it reminded me of something that Zip had said the last time we had you on, and this is related to the vaccine, I promise people, but it reminded me of something that Zip had said that really crystallized in my mind how I should be thinking about this economic recovery. And that is, we can't actually have an economic recovery. We cannot recover from the pandemic in the economy sense until we've actually biologically recovered from it, right? And so it was what, $2 billion you said, Bob?
For 100 million doses, and I think they are reserving the option to buy an additional 500 million doses on top of that.
Right. And so this is a huge investment in a vaccine that we haven't yet got, we've got evidence that it looks promising, but we don't have the clinical trials all complete yet. But to think about this is one of the first times where I've really felt like the government is looking at this from the standpoint of we cannot solve the economy until we are actually paying attention to the prevention and treatment of the actual disease. This is really fascinating to me.
And I think what's fascinating to me is the fact that even if they spend roughly the same amount for 500 million doses, which would get them to about $10 billion, that's 0.5% of the cost of the CARES Act, right? This is such a relatively small amount of money in the grand scheme of the federal budget that can be used in this way. And what's, I think a really important move towards providing a universal vaccine.
Well, and Zip, I was wondering if you could talk a little bit about different, we've just been talking about now the US response to spending money on vaccines. And I'm wondering if you know about the international, that balance that you were talking about. We can't actually deal with the economy until we've dealt with the pandemic. And I'm wondering if you could talk about the way that you see parallels between what the United States is doing and other countries, or what other countries are doing that clearly the United States still needs to do.
Well, so we can talk. So certainly, this is an unprecedented, shock to the global economy here. We have never had something like this before. Its depth, its global reach are huge. We've never seen anything like that. But then it doesn't mean it's going to affect every economy the same, right? So some economies are going to be more vulnerable than others. So what types of economies will be the most vulnerable to this pandemic? A variety of factors are going to determine that. But I think the three most important factors to consider are certainly number one is how well you respond to the pandemic. Yeah, how well you control it. The second factor is your linkage to the global economy. Because this is a global economic shock, the more linked you are to the economy in terms of trade, of foreign investment, of international remittances, then the more you are affected. But then the third factor is your ability to borrow. So when you have a negative economic shock, you can cushion the shock by borrowing and spending and stimulating your economy in a bad year. But if you can't do that, then certainly the shock on you is worse. Okay, so if you look at these three main factors, so we can use some examples here. So say Vietnam, which is where I'm from, so I know the most, which is why I'm using this example. In terms of the first example, the first factor, the country has managed or responded to the pandemic very well. So as of now, it essentially has eliminated the virus. So in terms of factor number one, it has protected both the public health and the economy. But it doesn't mean Vietnam doesn't suffer because it's very integrated into the global economy. Its trade as a share of GDP is 200%. Okay, it's one of the most integrated economy in the world based on that indicator. So that is a major shock, even if it escaped the pandemic. Okay, so if you put all that factors together, the economy is expected to grow at 3% instead of 7%, which in the grander, the bigger picture is not a bad thing. Okay, 3% growth is actually pretty good for this year. So that's Vietnam, right? Now we can use the US as an example. In terms of factor number one, the US has failed miserably in controlling the pandemic. It has failed to protect the public health, and it has failed to protect the economy, right? Because without the public health, you can't have a good economy going. So number one is out. So but then in terms of number two, this is where a lot of people are surprised. The US economy in terms of trades as a share of GDP is not that linked to the global economy. Trades as a share of GDP for the US is only about 28%. Now compare that to the Vietnam's case of 200%. Okay, so the US kind of escaped through the second factor, but then the first factor is what is really dragging its economy down. Now, in terms of the third factor, your ability to borrow to cushion the negative shock, well, the US is actually heavily indebted, but despite that, its ability to borrow is very high. Okay, so there's a more complex story behind that. So putting all those three factors together, the US economy is expected to shrink somewhere between 5, 6, or 7, or 8% this year. Okay, wow. Instead of growing 2 to 3%. Okay, now I think the countries that are most vulnerable to this pandemic will be a lot of the developing countries which have poor capacity for public health, which are dependent on exports, reliant on the global economy, and heavily indebted, and as a result, cannot borrow. If all of these three factors, and they don't have it, and in a combination of the three of them, those economies are going to be devastated. Yeah.
Wow, I mean, that's, to me, like, that's really intense, but it makes so much sense as you think through it. I mean, it also, especially the borrowing pieces for me, just so important. Do you have I mean, if you don't, it's totally fine, but do you have an example of a country or two where that sort of perfect storm of convergence is likely to be a real problem?
Some heavily indebted African economies, Ethiopia, Mozambique. If you look at the data on their borrowing costs, at the beginning of this year, January, their borrowing cost was about a few percent, and now it has risen to over 10%.
Right.
Well over 10%. So within a few months, with the uncertainty and the shock to the global economy, their borrowing costs skyrocketed. Right. At the same time, when they have a need to borrow to cushion their economy.
Right on. Okay.
So that's what I said.
Thank you.
So
thank you.
Either Zip or Bob on this one. Kind of following on this idea of sort of borrowing or where the money comes from, that was a lot of the questions that our students were kind of wrestling with, right? The readings they had these sort of suggestions from economists, but then the question was kind of like, well, where do they get the money? And it sounds like, and this is what we were kind of suggesting on Monday, was, well, the US actually has the ability to borrow a lot of money. Basically unlimited, not truly, but a lot of money. But so how does the US compare? Is the US an outlier in its ability to do this? What have other countries that have had successful relief plans done to fund them? And then are the options different for the US compared to some of these other countries?
Well, the Treasury securities that the US federal government sells to borrow are viewed as free of default risk. Okay, so you're always going to be paid back the principal plus interest anytime you buy a Treasury bill or a Treasury note or a Treasury bond. And what makes it financially more feasible to borrow a lot these days is that interest rates on Treasury securities are very close to zero nowadays. The part of our budget, the federal government budget, that has to get devoted just to paying interest on all of our outstanding debt is much smaller due to the fact that interest rates are so close to zero. So that's an important factor for the United States as well.
Well, to the question of where does the money come from for borrowing, I think you should be aware that you can have the notion of a country borrowing, but you can also have, within the country, you have the households, the private sector, the firms, and then also the government. So a lot of time people conflate a country borrowing with a government borrowing, right? So the US government is having all this stimulus package and it's running a huge fiscal deficit, so it's borrowing like crazy. So where does the US go? Where is the money for the US government to borrow from? It can borrow from its own domestic citizens, households, and firms, but a lot of it can also come from abroad because we have globalization, international finance. So countries have the ability, well, at least some of them have the ability to borrow from abroad, and the US ability to borrow from abroad is very high because, like Bob was saying, a lot of other countries tend to view lending to the US to be very low risk. It's almost like a haven for safety investment. Okay, so that is a perk of being a US citizen. You have access to have very cheap credit. Okay, but in general, though, in these years, in terms of global finance, global interest rate has been relatively low throughout many. So we've had what we call the global saving glut. We have too much finance in the global market. So interest rates have been low. So if you wonder why the US keeps borrowing, because interest rate is low, it's cheap to borrow. That's why the country keeps borrowing.
So we have a question from one of the students in the class from Facebook too. It's, does globalization play an important role in balancing the economic shock among countries? Or will it help to coordinate better the countries? Do you see more coordination and cooperation between countries? Or do you think that it's going to cause more rifts and divisions between countries?
So on the one hand, some people will recognize that this COVID-19 is spread so fast and so far because we have globalization. We have movement of people, we have movement of goods and services. That's why it's spreading fast. Okay, so you can blame globalization partly for this pandemic. And then some people also recognize that, oh, we've been relying a lot on the global supply chain, and now the pandemic is disrupting a lot of that. So we need to reduce this reliance. So some people, based on that, may conclude that we need to have less globalization. So that's one view. Now, another view could be, but actually, more than ever, we need global cooperation. Why? Because the pandemic, by definition, is a global problem. If it's a global problem, it requires a global response. Which means that one country alone is not going to be able to solve it. And so I would say that it's not so much that we need to have less globalization. It's more about, we need to work on certain aspects of globalization. We need to work to diversify our economy more than ever. And we actually need to encourage more cooperation in terms of, technological developments, developing vaccines, producing vaccines. But we do certainly need to improve the resilience and the diversification of our global supply chain. The pandemic has revealed a lot of weaknesses. Yes.
Yeah, I think that there's from a public health and an emerging diseases perspective too, you've kind of tied in a really important concept there, that since we are so connected, that's why this has spread so much and it's spread so quickly. And we talk a lot about this in emerging diseases with the challenge of the global connections as being a conduit for, actually moving the disease around and, actually having transmission too. And it's important to remember that if we're going to control it, we have to think about that too. So and we have to think about how the interconnectedness matters for the recovery, not just from the disease too. So Ron, go ahead. I think
yeah, so So I'm sitting there thinking, yeah. So Bob, what is that you got back there?
Well, it connects with some scatter plots that I made, which I can show by a screen sharing here in just a moment. But it kind of connects to the reading that your students did in your class. And one of the points that Stephen Barry and Zach Cooper made was that, unfortunately, some people think that there's a trade-off between the economy and public health.
Mm-hmm.
And if there really were a choice between the economy and public health, then a scatter plot where you have the increase in the unemployment rate on the vertical axis and the number of COVID cases on the horizontal axis would be downward sloping.
Right.
So according to the kind of the spurious argument forthcoming from some people, if you were to try to get a low amount of cases, you'd have to accept a high increase in unemployment. Or if you wanted no change in unemployment, you'd have to accept a high amount of COVID cases. But it turns out that this is a false choice. And the actual data, I'll try the screen sharing, is right here. These are actually just quotes from your reading. So from the earlier reading from April the 16th, I need to scroll
And
up
I'm
here.
posting links to these on Facebook right now too for the audience.
Sounds great.
Thank you.
So in your first reading, Stephen Barry said there's near unanimity among mainstream economists that the first rule of pandemic economics is to fight the cause of our economic problems, the COVID-19 virus itself. And Cooper follows up and says, some have framed the reopening as a debate between economists and public health academics, and this couldn't be further from the truth. So the scatter plots that actually exist, if you take data from the United States, are not downward sloping like on my chalkboard, but upward sloping. Okay, and so again, what I have is the change in the unemployment rate from February to June in the 50 states plus the District of Columbia on the vertical axis, and cases per million people on the horizontal axis. And I'll just pause to note, you might have heard the news this morning that California is surpassing New York in total cases.
Yes,
and oftentimes when we hear news like this, they're reporting aggregates. And it's better to adjust those aggregates onto a per capita basis. So with regard to cases per million people of population, I don't know if you can see California, it's actually in the middle, about 98 cases per million people. New York is out there above 200 cases per million people. Wisconsin is at about 72 cases per million people. But in general, the moral of the story here is consistent with what Ziep was saying and what Zach Cooper and Stephen Barry are saying. To fix the economy, you first have to address COVID and get rid of that. So if you want to have if you want to protect unemployment, if you want to keep unemployment rates low, you got to keep cases low as well. High amounts of cases correspond to states with high increases in their unemployment rate. Okay, and it's also an upward sloping relationship if it's deaths on the horizontal axis. This is deaths per 100,000 people. You'll notice that there are 6 states where deaths per 100,000 have been really high: New Jersey, New York, Massachusetts, Rhode Island, District of Columbia, and Louisiana. You can't really see Wisconsin on this list. It's kind of part of this jumble on the left. So what I also did was I dropped out those 6 really high states And so there's 45 dots on this scatter plot. And you can see Wisconsin better, it's at 15 deaths per 100,000. And our change in the unemployment rate has been 5% from February to June. It's up from 3.5% to 8.5%. There again, it's a positively sloped empirical regularity that we're noticing here, and not a downward sloping relation.
That's pretty compelling data there. I mean, I'm quite amazed at this. Anyhow, continue. Sorry.
Well, no, I agree. And then there's one really interesting scatter plot that I also made with deaths per 100,000 on the vertical axis and cases per million on the horizontal axis. So in general, if you have more cases, you're going to have more deaths, but it's not a linear relationship. Instead, it's quadratic. And so I think this is reflecting perhaps the fact that as cases get really high, stresses are imposed on our medical institutions. So the amount of attention that is provided on a per patient basis is probably less. So if you think to yourself, would I rather be in a hospital where there are lots and lots of patients, or at a hospital where there are relatively few patients? Where am I going to get the most medical attention? Well, it's going to be in those hospitals where they're treating relatively few cases. So I think that's what's perhaps going on with regard to this nonlinear relationship between cases per million and deaths per 100,000. And just to kind of conclude this screen sharing, again, in the more recent reading that you all did, the Berry and Cooper article in Politico, they stress a couple of things. It's vital for elected officials to realize that the stay-at-home orders and the social distancing and the masks and the school closures are not the primary cause of our economic dislocations. Americans decreased their economic activity before those orders went into effect, and will continue to restrict their activity as long as the threat of catching COVID-19 persists. So the only way to end our financial crisis and restore the economy is to address the pandemic itself. Okay, and there are 5 measures that they encourage down there at the end: increasing the supply of personal protection equipment, expanding testing, developing treatments, doing contact tracing, and what we were talking about at the outset, developing a vaccine. So I'll stop the sharing and return it to the big picture, and would be happy to hear your impressions about all of this.
So I would like to follow up one point on that. So the data you present, Bob, are for US states. Now, I don't have a nice graph like that for the global economy, but I bet you if you chart that, looking at the cases per million versus the unemployment rate at the for countries level, you see the same positive relationship. Countries that manage the pandemic, their economies are affected less.
I agree with Zep totally. And it's interesting, a lot of people have called attention to Sweden. And Sweden apparently didn't do much of anything. But if you look at their unemployment rate, and I was only able to get observations from March to May for Sweden, but their unemployment rate was up 3.5%. And it's the same thing Zep was talking about the global supply chain. So Sweden is going to have a lot of their manufacturing depending on inputs that they buy from other countries. And so that's going to slow down their production if other countries are experiencing recessionary disturbances as well. And similarly, Swedish citizens are going to be especially vigilant about not going shopping, given that the government has not done much of anything to encourage protection. So that's going to hit the demand side of the economy. So the global supply chain hits the supply side of their economy. the reduced consumption is hitting the demand side, and they're suffering their economy is suffering just like everybody else, while they're experiencing, unfortunately, many more cases and many more deaths because of their laissez-faire approach.
So this is what's so interesting to me is, we saw what now I think is going to become sort of, infamously known as the Swedish approach, that almost became the British approach. This idea about herd immunity, which we talked about actually in a previous episode, and how trying to achieve herd immunity while you're in the middle of a pandemic is just basically a way of saying, yeah, we're kind of okay with lots and lots of people dying because, that's more important. But one of the things that I loved about both the articles, and that you had the same authors, right, from they had a piece that they had published in April, and then one much later and much closer to us today. And the thing that jumped out for me is that really brings home the idea that, of course, the approaching public health and approaching the sort of economic circumstance that they have to be part and parcel of the same solution was the asteroid example that they use, right? To me, I'm sort of a space sci-fi guy, so this was the thing that got me. It's like, okay, if there's an asteroid coming, all right, and it's on its way, it's 4 months out, okay, yes, that's going to cause massive amounts of, social and socioeconomic disruption, right? And so the solution isn't then to give a stimulus package just to keep the economy going. Like, the solution is to get rid of the damn asteroid, right? like that's the solution. And of course, myself, like everyone else, I think we remembered Zip, that the first time that you two were on, just so poignantly saying, you cannot fix the economy unless you first fix COVID. And that is, I think this is sort of driven home. So for all those folks who think, oh yeah, it's this zero-sum game, right? You do one or the other. Like, no, they are both the part of the same solution. You can't do one without the other. Because people like me, I love going out. You all, especially my colleagues know me, I like to have some drinks. I like to do these things. I'm not going to any bar outside of my home bar. It's not happening until I have a vaccine, because I'm at risk. So I'm not doing it. So this is really important.
Well, and I want to follow up with this on a question about, we've been talking kind of about what's been going on, or what's been happening now, and how do we actually fix this, but thinking a little bit more into the future about the impact of, however we get out of this, whatever way we get out of this, vaccines, I'm like Ron, I'm not leaving my house without a vaccine. It just doesn't seem smart to me right now, but what was that, Zip?
You still can with a mask.
That's right. I'm not leaving my house without a mask.
Zip, I can't drink with a mask.
They have those masks with the little straw holes. I'm skeptical.
Also not doing that.
Very skeptical. Anyhow, if we think about, let's say that we do get a vaccine. Let's say that this vaccine works, and let's say that you've all seen Contagion, where they get the vaccine and it actually protects people from that. That was a much worse outbreak than this. Anyhow, if you haven't seen Contagion yet, don't watch it in the middle of a pandemic. Wait on that, people. Or watch it in a pandemic. I don't know. Anyhow, if we get a vaccine, and let's say we get an effective vaccine, and we do actually get this under control. One of our students was asking, is COVID-19 likely to change long-term economic patterns around spending and work? If we do get this under control, can we actually expect a return to normal for the economy? Or what's the new normal that we can expect next? Like, what does the future look like for us? Assuming that, 18 to 24 months from now, we have a vaccine that everybody has access to.
So I can talk, I think there are many aspects about the future we can talk about, but maybe the student has in mind the question of the future of work, okay? And now a lot of us are working remotely. We are right now doing something remotely. Let's talk coronavirus, right? Now the truth is this direction is going to happen anyway. with or without the pandemic. All these technologies that are coming out that promote, that make it possible to do remote work and more. And I'm talking about a global remote work. You can have a technician in India, controlling a machine in Mexico doing this, and and then people can do housework remotely and all of that. So all of that is going to happen anyway. But I think the pandemic is causing people to adopt the technology faster, pushing people toward that faster. So it changes the speed of it. It doesn't change the direction. Yes.
Yeah, I have to say, I think I agree with that 100%, Zip. I mean, this is, when we look out over the technologies, including all of the new tech that's sort of come out of the woodwork, or maybe it didn't come out of the woodwork, but has now come into the spotlight, right? The speed at which, even us, right? I mean, the way in which is like, oh, okay, we got to, wait a minute, what? We got to teach online, wait, what? And then, exactly, right? Like a bunch of us are like, what? And then now, so many of us are like, yeah, actually, I'm super comfortable doing that now. I've found that just personally watching that to be extraordinary. But I already have some anecdotal evidence of people I know who work in nursing and in hospital systems already talking about how, their companies, their organizations are saying, yeah, it looks like your efficiency is up. So yeah, let's let you work at home. So here we are. So I think that's definitely the case, and that this event sped that up pretty significantly.
And I want to add that, at Beloit College, we are aware of these changes, and we have been changing our curriculum, the way we teach, the way we prepare students for the future of work. So we are aware of these changes happening already. But now, the pandemic is telling us that we need to speed up our work even more.
That's
because
right.
the world is changing even faster than we thought.
So I wanted to.
One other change that we might see is with regard to the distribution of government spending. When we talk about spending for infrastructure, typically we think of roads and bridges. And I think in the future, spending for infrastructure is going to emphasize more hospitals and health care institutions. And we're going to see a greater budget for the CDC and the Department of Health and Human Services in the future.
So I wanted to ask sort of a follow-up to this, which is what role might, sort of kind of combining these ideas, what role might health insurance companies or Medicare play in maintaining some of these advances? So the anecdote I'm thinking of is my wife is a pediatric occupational therapist, and she immediately at the start of the pandemic, they moved to teletherapy. But what we've seen is that many companies are revoking teletherapy waivers as the Wisconsin stay-at-home order was overturned. And so are there other pressures other than just individual desires that might work towards sort of restricting this economic, this remote advance, or sort of pull us back in different ways?
Yeah, I mean, it sounds like rescinding those waivers is a market failure. And legislation like the Affordable Care Act was meant to address market failures like that. So we might need to strengthen the Affordable Care Act to address new market failures that we're noticing as this pandemic unfolds.
Yeah, I mean, I'll just jump in and say, I think that this is precisely why we can't take the sort of political element completely out of this either, right? I mean, at the end of the day, and Phil, your example of the overturning of the stay-at-home order is a perfect example of this, right? When we were looking at this back in May, and folks are going, well, of course, all of these other states are extending, we're going to extend too. And to have, one part of the government that is dominated by one party basically effectively unilaterally make a choice. Well, here's what we're doing. I mean, I think that was transformative. And of course, it has these knock-on effects to a variety of different policies, including reimbursements for these services that that quite frankly, we're not actually ready. I mean, all of the evidence suggests we're actually not ready to go back to in-person stuff yet, right? And yet the withdrawal of that of the reimbursements only threatens to affect the economic health of course, individuals, but then of course knock on the states and the countries as well. I mean, it's extraordinarily short-sighted, but at the same time, there's this political element that in the U.S. seems to have a starring role in all of this. And of course, we're talking about econ today, so I'm not going to dive further into that per se, but it does really strike me. That's why we have to constantly keep that in mind, or in the back of our minds, I suppose.
I think related to that, another set of questions from the class kind of ask, what are the potential long-term consequences to the US economy as the government continues to fail to act? And I think specifically about two things that are coming up that as of this morning when I was listening to the news, they still didn't have a decision about, but things like moratoriums on evictions and the unemployment insurance, that extra $600 from the government for people who are unemployed during this time. If those, like, what are the short term? How do you think about this short term? How do you think about this long term?
There were aspects of the CARES Act that intended to build a bridge from where we are to hopefully where we might get back to after COVID has been addressed and the economy begins to recover. Those PPP loans, I think, ran their course, and there's been talk of renewing opportunities for those. But I guess they remain under consideration. And in terms of the extension of the unemployment benefits, again, I think that's still being debated. But we need those bridges to continue to exist so until we get to the other side. We've been given some sources of optimism with these potential vaccines. So maybe the bridges don't have to be exceptionally long, but for the time being, I encourage policymakers to extend those bridges.
Well, that's it. That's really actually fascinating to me from a biological perspective, because we talked about the idea of treating the symptom versus treating the disease, where the disease is an actual disease in this case. But the economy and the downturn that we've seen is a symptom of the larger problem of the pandemic, right? And so we need to take care of the pandemic, but you've put it in a really interesting, like, that term bridge really works for me, because even when we're thinking about treating people who have a particular disease, we've got a number of diseases that we don't have treatments for along with COVID. So for example, we don't have a cure for Ebola. And so we do what's called supportive therapy for people who are infected with Ebola. And all of us have done this to some extent when we've been sick. When we have a cold, we don't have a cure for the common cold, but what we do is we rest, we take in fluids, we make sure that we're hydrated, that we're well fed, and all of that. We support our immune system as it's trying to fight the disease. And so that idea of we have to make it through this, and that's the point of this. That should be the point of some of these stimuli, should be the point of our economic policy, to get people through this and to get people through it healthy, so that when we do come in with a vaccine or a cure or whatever, we're able to do it. So that's, I think, it's a really powerful thing to think about, that it is not fixing the problem, it's getting us to the point that we can fix the problem. So I'm leaving all of the econ talks with like these, brainstorms of understanding finally. So thank you for that.
Yeah, Rachel, I mean, before we pop over to Phil, I mean, I just want to say, I think that the final point you made is key. You know, part of having a medium to long-term perspective on things rather than a short-term perspective is understanding where you want to be when all of this is over. And if where we are is that we have all of these people who are sick or have sort of secondary conditions because they had COVID, where they are going to have their productivity severely undermined or impacted, how does that benefit us then in terms of our long-term economic thinking, right? This is why it's so short-sighted. When the damage that COVID does to many people is lifelong. We're starting to understand that, right? In terms of reduced lung capacity, in terms of a variety of different other issues, as we saw, like people like, unfortunately, like Nick Cordero, we can't predict how it's going to affect some folks. And so to me, it just makes sense, if possible, to do what we can to avoid people getting it at all until we're on the other side, right? Phil, you have an interesting question I know you've been sitting on. Jump over to it, please.
Sure. So kind of drawing on a few of the questions that our students posted on Moodle, what we saw, and correct me if I'm sort of misrepresenting, what we saw was sort of an initial downturn, a steep downturn in the stock market, and then that V-shaped return, right, of the stock market in a way that we haven't seen with unemployment or lots of other some of these other indicators, economic indicators. And one of the questions, or some of the questions, were concerning sort of equity in economic recovery. So why is it that the stock market can rebound this quickly? Why is it so sort of disconnected from economic activity? And then sort of related to that, are there sort of fiscal or monetary actions that can be taken that have not been taken that have allowed investors to maintain this wealth while sort of lower and middle class individuals have not sort of seen as much of the recovery?
I love it, Zip, that you just had something ready for this. This is
know.
Incredible.
See, that's what I'm talking about.
This is beautiful.
I just happen to have the graph of the stock market. So you can see here the red, this is from zero, from the day when the crisis happened. We can actually have the data for the 3 recessions in 2000 in blue, and yellow would be 2008 financial crisis, and red is the current crisis. So you see that the drop was steep, but then it rose up again very fast. You see how different this pandemic and the impact on the stock market is compared to the other ones. So I think it's because when it first happened, it dropped very dramatic because we had never had anything like this. So people were extremely scared, right? And that reflects that. But after some time, I think increasingly investors recognize that it's going to be more of a short and medium term problem. And so I think the coming back of the stock market is reflecting that. Yeah.
And would you say also that it's also partly a function of the fact that so many sectors actually ended up benefiting or seeing some of their performance sort of improve in ways that they hadn't imagined?
Maybe, but I don't think the data are out yet on that. But it's a possibility. Yes. Mm-hmm. But you see how it dropped extremely fast, compared to the other crises, because people were so scared. I mean, we've never seen anything like this. Who knows what's going to happen? But now more and more people recognize that it will eventually go away, and they think of it as a short-term problem. So that reflects that coming back. Yeah.
So do we think that then, because the stock market came back in a way that other indicators haven't yet, is this exacerbating inequalities in the US system, or is it just sort of making the point clearer but not really making it any worse? Are these companies making a lot of money sort of at the expense of workers in some sense?
Well, before I answer that question, I want to make it clear that the stock market isn't always a good reflection of the economy. Okay, so it's a reflection of investors.
Right, exactly.
That's about the only thing that I know about the economy. I got to be real honest, and I learned that from Marketplace Money on NPR. The stock market is not the economy. Anyhow,
Yeah, it's of the economy. So, well, obviously, we don't see the economy bouncing, going down and up like that. In terms of the equity issue, I actually don't have much to say about it in the United States. I've read a variety, and there are conflicting views and data on that. I've read some that say that there is a potential for, if it's done right, this fiscal stimulus can actually reduce inequity. So I don't know. I don't know for the U.S., but I know for the global economy, though, global poverty rate is going to go up. And this is a sudden reverse in trend. It's been many, many years, many decades of dramatic reduction in global poverty, and suddenly it's going up. Why? Because earlier on, I talk about the countries or the economies most vulnerable to the pandemic, but within each economy, there are some populations that are most vulnerable. In this pandemic, the people most vulnerable in developing countries are those in the low-skilled service sectors, those in the informal economy. Like before the pandemic, they were already the worst of population. They're always on the verge of falling back into poverty. So this pandemic is pushing many, many millions of people in developing countries back into poverty. So it's very unfortunate, like that for the first time in a long time, we see global poverty rate going up. Yes.
One other quick thing about the stock market, the traders there are thinking about the future. So as they buy and sell shares of stock, they're making bets on what they think the future is going to look like. And so that's why it's not a great indicator of the present.
That's an excellent observation. Thank you so much, both of you. Yeah, as we're heading towards the end of our hour, of course, it's flown by. Any other thoughts and comments from either from our listeners or from our other folks here? Rachel, Phil?
I actually have just one comment that kind of came up in our discussion in class. Like, if we in the United States have the ability to borrow money, and if these public health measures are going to save the economy by taking care of the coronavirus, what's standing in the way? I mean, are there economic factors? Like we've talked about the political factors that are standing in the way. Are there economic factors that stand in the way of making this choice to do what the authors of those articles were suggesting, to really try everything that we have at our fingertips?
I think this come back to the beginning of today's discussion. I talk about the three main factors that affect an economy's ability to deal with this shock, right? One is how well you deal with the pandemic, and in terms of public health. And second is how integrated you are into the global economy. And so the US is actually not that integrated, right? And third is your ability to borrow to cushion the shock. And the US ability to borrow is pretty high. But it's number one, the pandemic is so bad here, right? That even if it can borrow, even if it's not that integrated into the global economy, it's still suffering a lot. So those are the economic factors we're looking at.
Mm-hmm.
Yes.
It just seems that I don't know. It's something that's boggled my mind, to think about. Especially when we look at the rescinding of the stay-at-home order in Wisconsin, in Georgia recently, the mask mandate, and then the statewide decision that local governments can't, have a mask mandate. These things are at odds with what I think people are really trying to accomplish in the idea of they're so focused on the economy and the effect of the pandemic on the economy, and really racing to fix the economy without the clear recognition of where the problem is coming from. I think that's something that's continues to not make a lot of sense to me. and I'm seeing both of you on this on my screen here nodding. And so
Yeah, many people are seeing it wrong. They don't recognize that addressing the pandemic is how you save the economy, because that is the root cause of the problem. This is a supply shock. The stimulus and all these other the government policies, they are demand fixes. You can't use demand policies or demand fixes to fix a supply problem. There you go. Yes, it's the wrong one.
Well, and to me, it just comes back to what we see in so much psychological research around the role of anxiety. To put the sort of bluntest explanation on it, we think of anxiety as what we would call an avoidance emotion or an avoidance sort of affect. And when there's anxiety around a pandemic, around your own economic position, we should expect people to withdraw from the economy or to move towards sort of avoidance. And so to that extent, this is, without, like Zip says, without addressing the root cause, we're not addressing the source of anxiety. And so we can't really expect people to move back into the economic system without addressing the cause of that anxiety.
And
There's a question from Facebook about, if we have a minute or two, about the role of the IMF, the International Monetary Fund, and the World Trade Organization, the WTO, in helping to reduce the global economic shock. My view is nothing. They have no role. The truth is, in recent years, the role of these international institutions have been diminished a lot. Look at the trade war between China and the United States. Why is the WTO in any of this? They haven't done anything. Their roles have diminished a lot. So post-pandemic and in the coming years, gradually, there will emerge a new international order. Those old international institutions were created in a different time. So I think these international institutions are increasingly become irrelevant. What exactly new international order and institutions are we going to have is difficult to imagine. But the IMF, the WTO, that's kind of my answer. They're not doing much other than producing and they have to borrow from.
So I didn't know in economics that's like one of your like professional things.
No, just
that was brilliant.
So we'll end on that. Thank you so much, Bob and Zip. This has been just absolutely fascinating.
Amazing.
Thank you so much to our students who posed such thoughtful questions. I have to say, Ron, maybe you disagree with me, but I enjoy this Let's Talk Coronavirus so much more now that we've got students posing such thoughtful questions. It's really enriched the discussions, and it's been great. And so thank you for everybody who poses questions in Facebook too. It's really wonderful to have that. So with that, we're going to end with, like we always do. What are you looking forward to this week or in the coming few days, Zip?
Oh, maybe borrowing an inflatable pool for my children to play in.
Yes, excellent. Bob, what are you looking forward to?
So I can't bring them to the public swimming pool anymore. I don't want to, so that's gonna be my substitute.
Yep, nope, a personal pool is the way to go.
Yep.
Bob, how about you?
Well, I'm in a fantasy baseball league with Sean Gillen and George Williams and Chuck Westerberg and Matt Tedesco and Chuck Lewis. And we've got some alumni, Beloit College alumni in our league as well, perhaps watching today's broadcast. And the first game of the season is tomorrow, so I'm looking forward to that.
Oh, excellent. Phil, how about you?
The easy one, I'm looking forward to dinner. We're making fried rice tonight. So that's the easy one. And then going camping next week. So that's the big one. Awesome.
That is very exciting. Ron, how about you?
Yeah, so I did something a little bit radical today. I got some peaches and I decided to steep some vodka in it. Most of you know I'm a big cocktail connoisseur and creator, right? So I'm looking forward to the next week after I steep that for a bit to see how it tastes. So.
Oh, that sounds delicious. And I just got Leviathan Wakes on my, I've
Get
been
it.
waiting for it on the library loan on my Kindle. And so I'm about 60 pages in, and I'm loving it. So.
Ready to chat with you as soon as you wrap it up.
Yes. Well, I need to rewatch The Expanse now too. So
of course.
Yes. So lots to talk about. But anyhow, again, thank you all for joining us. This was delightful as always. Thank you again to Zip and Bob for joining us today and for providing interesting readings for our class. Reminder to students in the class, you have a reflection due on Friday.
Ooh.
Okay. All right.
I'll be grading it.
And thank you, Whitney. Thanks, Whitney, for
thank you, Whitney.
all of your
Thanks,
work.
Whit.
All right. Bye-bye.
Bye-bye, everyone.